Namaskar, my name is Dr. Tarun Jindal and I am the head and senior consultant of Uro-Oncology and Robotic Surgery at Narayana Superspeciality Hospital, Andul Road, Howrah. As we all know that this month is being celebrated as Bladder Cancer Awareness Month, so I will be talking to you about what is bladder cancer, how does it present, and what are the management options. Bladder cancer is a very common malignancy and usually occurs in people who are 60 years and beyond. It is more common in males as compared to females. The reason of bladder cancer being more common in males is because of the histories of smoking, history of tobacco intake, and nicotine in any form can lead to bladder cancer. There are certain idiopathic factors and genetic factors also associated to bladder cancer, and there are also certain dietary factors like the presence of arsenic in water which are directly related to the incidence of bladder cancer. What are the common signs and symptoms of bladder cancer? So most of the patients will experience blood in their urine, which in medical lingo we call it as hematuria. This blood in the urine is usually gross, that is the entire urine will be blood stained. It is usually painless, that is the person doesn't have any burning in micturition. It might be associated with passage of small clots, and it may be intermittent. So it is usually not a continuous bleeding in the urine. So a person may experience it on a day and it will stop on its own the next day. The main important sign of bleeding in urine should never be neglected. Any amount of bleeding in urine should always be investigated by a urologist. What is the management of bladder cancer? So first of all, we investigate the patient by doing an ultrasound or a CT or an MRI depending upon the presentation. And once we have the information available, we plan for surgery. The surgery may be endoscopic, that is a transurethral resection of bladder tumor in which we cut the bladder tumor and send it for biopsy. In a significant amount of patients, this surgery might be curative, that is in patients in which the bladder cancer has not gone very deep, this transurethral surgery may be completely curative. In certain patients in which the bladder cancer has gone deep inside the muscle of the bladder, the management will vary from surgery of removal of bladder or chemotherapy to downstage the tumor followed by surgery of the bladder. This surgery of the bladder was conventionally done by open approach, but now we are doing it with robotic platform. The advantages of robotic platform in management of bladder cancer are that is the blood loss is significantly low, the pain which the patient experiences is low, the scar which we have to give for the removal of the bladder is extremely small, and the recovery is faster and the hospitalization time is significantly less. So the crux of this entire discussion for today is that please do not neglect any bleeding which happens along with urine. You have to consult your doctor, and for the hematuria specifically you will have to consult your uro-oncologist, and please get proper treatment, because if timely treated, this is one of the most gratifying cancers to treat and the outcomes are extremely good. Thank you.